Hello all, welcome to Pharmanandan. In this video we are going to discuss pharmacology of diuretics at beginner level. This video is useful for second year prof theory exams, useful for any competitive exam, PG entrance exam also. Before starting this topic, diuretics, let us recap the physiology of the nephron just for 1 minute. Let me draw the diagram of nephron. Okay. See, this is the blood vessel. Blood goes in this way and blood comes outside this way. Okay, let me draw the schematic representation of the diagram of nephron, and do not draw this diagram in theory exams. Okay, this is for our understanding purpose only. Well, this is the PCT, proximal convoluted tubule. This is loop of Henle. This is distal convoluted tubule, and this is collecting tubule. Okay, so represent loop of Henle, I have drawn a loop here. Okay, this here we can see microvilli here. Here you can see microvilli here in the PCT. The main facts which we should remember always before studying diuretics is, from the PCT almost 65% of sodium which is filtered will be reabsorbed from the PCT normally in normal functions. Okay, from the loop of Henle 25% of sodium ions are reabsorbed. Okay, DCT, it is almost impermeable to water, that is water present in DCT will be locked here, it won't move much. Okay, and the other facts are this collecting duct, this is the site for the action of aldosterone, and this is the site for the action of ADH also. Okay, as you know, urine is collected here. Okay, everything is fine. Then what is diuretic actually? When should I call a chemical as diuretic? To label a chemical as diuretic, there should be two things which should be fulfilled. The first point is, a diuretic should have a property to increase rate of urine flow, and the other property is it should be able to excrete sodium more. When these two properties are fulfilled by any chemical agent, we consider it as diuretic. Okay, and the types of diuretics we study as per the structure of the nephron, that is the diuretic which act in the PCT area, we call them as carbonic anhydrase inhibitors. These act here in this PCT area. Okay, in the loop we use loop diuretics. Loop diuretics act here. Okay, thiazide type of diuretics act in the DCT. Okay, potassium sparing diuretics, they act in the collecting tubules. In this video we are going to study only first diuretic, carbonic anhydrase enzyme inhibitors, which act on the PCT, the first part of the nephron. Okay, in the second video we will study loop diuretics. In the third video we will study thiazides acting on DCT. In the fourth video we study potassium sparing diuretics which act on collecting duct. Apart from it, there are two other diuretics, special type of diuretics which are not actually used for the purpose of diuretics, which we will study in the last video. Okay, like osmotic diuretics. Okay, and dopamine is also has diuretic property when given in low doses, and neseritide. And these three drugs also we are going to discuss in the last video. Let us start carbonic anhydrase inhibitors. What are the list of drugs which are carbonic anhydrase inhibitors? First drug is acetazolamide. The second one is methazolamide. Third one is dichlorphenamide. Fourth one is dorzolamide eye drops, and brinzolamide eye drops, which we use for glaucoma purpose. As we discussed, carbonic anhydrase inhibitors act in the proximal convoluted tubule. So let us discuss physiology for in a brief. What actually this carbonic anhydrase enzyme does in a body during physiology. This carbonic anhydrase enzyme is responsible for reabsorption of almost 35% of sodium bicarbonate from nephron into the blood vessel, into the bloodstream. 35% of sodium bicarbonate is reabsorbed because of the activity of the carbonic anhydrase enzyme. Carbonic anhydrase enzyme. So beneficial, right? The same carbonic anhydrase enzyme has one more role. When liver is in dysfunction, when liver could not convert ammonia to urea, so ammonia keeps on accumulating in the body, right? Ammonia. These ammonium ions will be toxic when present in the blood. These ammonium ions are secreted from collecting duct, okay, so as to excrete through urine. Okay, this is also done by carbonic anhydrase enzyme. Okay, along with ammonium ions, it can remove a part of bicarbonate also. Along with ammonium ion, it removes a part of bicarbonate in the collecting duct through secretion process. Okay, this happens during liver dysfunction phase. So it acts as a protective. Okay, mainly the action of carbonic anhydrase enzyme is in the level of PCT. Apart from the nephron, carbonic anhydrase has role in two other places also. It pushes bicarbonate ion away from the blood. From blood. Where will it push the bicarbonate ion from the blood? It pushes the bicarbonate ion from blood to aqueous humor when this enzyme carbonic anhydrase is present in the acting on the ciliary body in the eye. Okay, when the same carbonic anhydrase enzyme is present in the CSF, that is in the choroid plexus, that is the roof of fourth ventricle, it pushes bicarbonate from blood into CSF. Okay, in the nephron, it pushes from the nephron part into the blood. In the other places, we see the movement of the bicarbonate ion from blood into aqueous humor in the eye, from blood into CSF in the choroid plexus. Chemically speaking, what does this carbonic anhydrase enzyme actually does? It has a property of conversion of total 3 chemicals. Okay, it can convert this carbonic acid by this enzyme, carbonic anhydrase enzyme. It can break it into water and carbon dioxide, and it can convert water plus carbon dioxide to carbonic acid again, and it can convert carbonic acid to proton molecules and one bicarbonate ion also. Okay, and it can convert proton and bicarbonate ion back to carbonic acid also. So this equation is important to relate the activity of the carbonic anhydrase enzyme. Okay, when does this convert from this to this, from this to that, is depends upon the situation. Okay, for us, for MBBS level, it is good to remember that it can do shifting of the 3 chemical agents in vice versa, in reversible fashion. Naturally, now you tell me, what can we expect if I inhibit this enzyme, carbonic anhydrase enzyme? Carbonic anhydrase enzyme inhibitors are given. Okay, that is these drugs. What will they do? When I inhibit this enzyme, there will be there will be no reabsorption of sodium bicarbonate, right? So what can we expect in the urine? There will be less reabsorption of sodium bicarbonate. So eventually we can expect in the urine more sodium is excreted, okay, and more bicarbonate is excreted in the urine. So we can say now, when there is more and more excretion of bicarbonate ion in the body, what can we expect? There is loss of alkaline substance from the blood, that is from the body. So what do we say that condition as? So when there is loss of alkaline chemical from the blood, from the body, we call it as acidosis. Okay, alkaline material is lost, so body is becoming more and more acidic. Okay, where this is happening? Actually, this is happening in the kidney. So we call it as metabolic acidosis. That is, carbonic anhydrase enzyme inhibitors has a property to cause metabolic acidosis in the body. Okay, why is this metabolic acidosis, whether it is useful in the body or it is harmful in the body, we can discuss in. And one more thing is, when the body is already in liver toxicity, when the body is already in liver toxicity, for example, what happens, there will be more and more ammonium in the body. Okay, carbonic anhydrase has to excrete ammonia. I am inhibiting this enzyme, so I can see a piling up of ammonium in the body. Okay, so in the liver dysfunction patients, I should not give carbonic anhydrase enzyme inhibitors. It will pile up ammonium ion in the blood. Okay, it is very dangerous. When it moves out, it reaches the brain, it leads to seizures and the hepatic encephalopathy. Okay, where are these carbonic anhydrase enzyme inhibitors are used? This dorzolamide, brinzolamide, I told you these are used as eye drops. Okay, usually all the CIIs are used for mostly for other purposes than actual diuretic purpose, because when it is given as a monotherapy, it is not so greatly effective as a diuretic. Okay, so we are repurposing these carbonic anhydrase enzymes to better indications, other indications. Okay, that is like in eye drops, it can be used in the condition of glaucoma. Okay, and where are these other drugs, acetazolamide and dichlorphenamide, are used? We will discuss now. First, starting with the acetazolamide drug. What are the indications of acetazolamide drug? Acetazolamide drug is used in the glaucoma. Okay, when in open angle glaucoma, used as tablets. When open angle glaucoma, it worsens to acute congestive glaucoma, that is angle closure glaucoma. When the patient comes to casualty in the emergency, we can use acetazolamide as IV injection, as emergency injection. Okay, what does acetazolamide do? It decreases aqueous humor production. Okay, it is used in open angle glaucoma, it is used in angle closure glaucoma during emergency. And the second use is, it is used as additive therapy to meningitis cases. Okay, and it is used in sleep apnea, and it has used in absence seizures in the past. Okay, and it has a role in gout, and it is used when CSF is leaking due to any trauma or tumor. Okay, and it has one more special use, and it can treat respiratory alkalosis in mountain sickness. Why? How? In mountain sickness, when patient moves up, okay, when patient climbs mountain, what happens due to hyperventilation, repetitive respiratory movements, what happens to the patient? The patient lands in alkalosis due to respiration. We call it as respiratory alkalosis. How can I reverse respiratory alkalosis? I have to create acidosis in the body. Anyway, we know carbonic anhydrase enzymes inhibitors, they are causing acidosis through kidney, right? So it can counteract with the alkalosis, and it can give relief to the symptoms of mountain sickness. Apart from these 7 indications, there are 2 more points which we should remember about acetazolamide. Those 2 points are, the thing is, acetazolamide, we can see here, the sodium bicarbonate reabsorption is inhibited, right? So more sodium will be present here. It travels into the loop, into the DCT, and to the collectant tubule, right? So there is a delivery of more and more sodium chloride because of here blockade. Okay, more sodium chloride delivery will be seen in the distal part of the tubule. Okay, what happens when more sodium chloride is sensed by the nephron? Automatically there will be a tubuloglomerular feedback. What happens because of that feedback? There will be constriction of the afferent arteriole. Okay, when afferent arteriole, we can see the constriction. Arteriole is when constricted, filtration rate will be decreased. We can see decreased glomerular filtration rate. And regarding the nephrolithiasis, carbonic anhydrase inhibitor, that is acetazolamide, has 2 properties. It can worsen calcium stone formation. Okay, it can worsen phosphate stone formation. Okay, they can cause calcium stones, they can cause phosphate stones, but parallelly it has it has a beneficial effect on cystine stone formation. So it can prevent cystine stone formation, it can prevent the formation of uric acid stones also. That is the reason, in a condition when we see more cystinuria, in the cases of cystinuria, it itself is an indication for acetazolamide. Okay, acetazolamide is an indication for cystinuria also. Okay, we know that this acetazolamide is inhibiting carbonic anhydrase enzyme. Okay, how does these drugs inhibit carbonic anhydrase enzyme? That is, whether it is reversible or irreversible, we should remember this point. Okay, carbonic anhydrase enzyme inhibitors inhibit the carbonic anhydrase enzyme in a reversible fashion, plus there is a paradox here. Okay, in non-competitive manner. Okay, then we can go to another drug, dichlorphenamide. Okay, what is the point we should remember about this dichlorphenamide drug? This dichlorphenamide drug is approved for a condition called familial periodic paralysis. What is the thing which, how this dichlorphenamide is helpful in familial periodic paralysis? Because the treatment of familial periodic paralysis is to induce metabolic acidosis in the patient. If we induce metabolic acidosis in the patient of familial periodic paralysis, it can treat the patient. This dichlorphenamide drug, being a carbonic anhydrase inhibitor, we know it has a side effect of metabolic acidosis, so it will be useful in the treatment of familial periodic paralysis condition also. The side effects due to carbonic anhydrase enzyme inhibitors are: the first side effect we know, metabolic acidosis. It is protective for certain diseases, but when if I keep on giving in more and more doses, this will be troublesome. Okay, and regarding serum potassium, we can see hypochloremia, hypokalemia due to these CIIs. The thing which we should remember is maximum hypokalemia, most worsened hypokalemia among all the diuretics when we compare, it is seen with carbonic anhydrase enzyme inhibitors. Okay, we should be very careful when we are giving these drugs. Okay, to keep, we should keep on periodically checking serum electrolytes, and we can expect hyperchloremia. Okay, and we know, as we discussed already, it can lead to formation of calcium stones and phosphate stones. Okay, and when given a large doses, it is seen that paresthesias are observed in the patients, and it can cause bone marrow suppression also. By this we can conclude the discussion on carbonic anhydrase inhibitors. Before wrapping up, I want to reiterate one point. Okay, so this thing we should be very careful when during clinical practice and even during competitive exams also. In a liver cirrhosis patient, in a patient with liver dysfunction, okay, carbonic anhydrase enzyme inhibitors when given, there will be um, poor elimination of ammonium ion. Okay, basically this enzyme will eliminate ammonium ion in collectin tubules. I am inhibiting this enzyme, there will be pooling of ammonium ion, it will reach to the brain, it causes encephalopathy and coma. This is very important contraindication which we should be very careful during clinical practice. So this is very commonly repeated MCQ in competitive exam also with respect to carbonic anhydrase enzyme inhibitors, and the side effects are very important. Okay, yeah. So thank you for watching this carbonic anhydrase enzyme inhibitors. In the second video, we are going to discuss the next part, that is loop of Henle, the second part of the nephron. So the drugs which are acting on the loop of Henle are loop diuretics. Okay, in the video 2, we are going to discuss loop diuretics. And thank you for watching. For any queries, feel free to comment in the comment box below. I will read each and every comment. Thank you for watching.